Today we will discuss high-yield concepts of traumatic brain injury. Let's move towards the definition. Traumatic brain injury is any insult to brain which is not of degenerative or congenital nature and is caused by external physical force. This physical force will lead to a wide variety of symptoms. Talking about causes, we consider any outside force which impacts on the head. It can range from a direct blow to rapid acceleration and deceleration of head. Before moving towards the symptoms of traumatic brain injury, it is important to understand the pathophysiology of disease. Pathophysiologically, it is divided into primary injury and secondary injury. Primary injury is induced by mechanical force of contact or by acceleration and deceleration. It occurs at the moment of injury, and it can result in wide range of problems like concussion, contusion, hematoma, or diffuse axonal injury. Contusion is the most common focal brain injury when we talk about primary injuries. In contusion, petechial hemorrhages form at first which lead to hematomas later. Hematomas can be of three types: extradural hematoma, subdural hematoma, and subarachnoid hemorrhage. Extradural hematoma is caused by medial meningeal artery. Subdural hematoma is caused by disturbance in bridging veins in subdural space. Subarachnoid hemorrhage occurs when there is damage to vessels in posterior fossa stalk. Then comes diffuse axonal injury. It includes injury to cranial nerves or pituitary stalk. It is the most common pathological feature in traumatic brain injury and it is not visible on CNS imaging. It's caused by rotational acceleration of brain tissue which produces shear forces leading to swollen and disconnected axons which ultimately lead to diffuse neuronal dysfunction. Secondary injury is not mechanically induced and it occurs hours or days after the injury or event. It's caused by decreased cerebral blood flow which leads to cellular pump failure, and after that there is a series of events which eventually leads to neuronal death. We summarize the causes of secondary brain injury. It is hypotension, hypoxemia, hypercarbia, hypothermia to infection and seizures. The level or severity of the disease is calculated by three factors. The one is GCS, other is post-traumatic amnesia and loss of consciousness. On the basis of these three factors, we decide a patient of traumatic brain injury being mild, moderate, or severe. In mild patients, GCS will be ranging from 13 to 15, and post-traumatic amnesia will be less than 1 day. Loss of consciousness will be less than 30 minutes. In moderate cases, GCS will be 9 to 12, and post-traumatic amnesia will be ranging from 1 to 7 days, and loss of consciousness will be less than 24 hours. In severe cases, we find GCS being between 3 and 8. Post-traumatic amnesia will be of more than 7 days and loss of consciousness will be greater than 24 hours. From these factors, we can calculate the prognosis and outcome of the patient. Let's move towards the sign and symptoms of a patient coming with traumatic brain injury. These symptoms depend on the severity of the disease. In mild cases of TBI, patient will be conscious and patient may remain conscious or may lose consciousness for a few seconds or minutes. Other symptoms of mild TBI include dizziness, nausea, vomiting, lightheadedness, ringing in the ears, bad taste in the mouth, fatigue, lethargy, and changes in sleep patterns. Cognitive symptoms may be confusion, trouble with memory, concentration, attention, or thinking. In mild cases, there will be headache that does not go away, repeated vomiting and nausea, weakness, numbness in the limbs, dilation of one or both pupils, aphasia, confusion, or agitation. In severe cases, these symptoms are magnified by intensity, frequency, and severity. We will move towards the diagnosis of a patient coming with traumatic brain injury. After GCS, we go for CT scan, which is easily available in the emergency room and is preferred when patient comes to emergency. MRI can show more details than CT, but it is not used in emergency setting. X-rays are used in mild cases of traumatic brain injury. Angiography is used to detect blood vessel pathology. EEG or transcranial Doppler may also be used.